name is Naty, and
Hi.
I'm a nurse practitioner with Grand Canyon University, and I will be doing your physical examination. But before we start, I'm going to wash my hands and prepare my supplies.
Okay.
And my supplies are all ready. And can you tell me about yourself, your age, race, birthday, and the gender that you associate yourself with?
I'm 43-year-old male, Caucasian. My birthday is August 13th, 1973.
And what brings you to the office today?
I have pain in my right ankle.
When did the pain started?
It started about 2 or 3 days ago.
And what makes the pain worse?
When I walk on it at work,
What makes the pain better?
when I rest it,
Can you describe the pain?
it's kind of like a numb kind of pain.
Does the pain radiate anywhere on your leg?
No.
Uh, from 0 to 10, 10 being the worst and 0 being nothing, how do you rate your pain?
4.
And what time of the day the pain is worse?
Between 2:30 p.m. and 11 p.m. when I'm at work.
And what time of the day the pain is better?
Later in the evening when I have a chance to get off of it.
Okay, now that I know about your symptoms, I want to know you better. Um, when was your last, how has your health been?
It's been fine
And when was your last physical exam?
within the last 2 years.
Okay, and any significant results or any abnormal findings?
None.
Okay, do you have any chronic illnesses or illnesses that persist for a long period of time?
I do not.
Do you have any psychiatric disorders like bipolar disorders, mood swings, depression, anxiety?
I do not.
Do you have any infectious diseases like HIV/AIDS or hepatitis C?
No.
Do you have any allergies to medications, latex allergy, seasonal allergy, or environmental allergy?
Not that I'm aware of.
Do you have any surgeries in the past?
Yes, I did.
What kind of surgery?
I had third-degree burns, which needed skin grafts on my leg.
Was there any complication?
No, there was not.
What kind of anesthesia you had at time?
General anesthesia.
Okay, and any injuries that require hospitalization in the past?
Yes, for the third-degree burns.
Okay, and how about your childhood immunization? Did you receive all your immunization?
Yes.
And did you get your flu vaccine this year?
Yes, I did.
Okay, and if this is a female, I would ask about her menstrual cycle, how heavy the flow is, and if she has symptoms like cramping. I will also ask about her pelvic exam and any pap smear. Okay, my next sets of questions are rather personal, but this is important to us and we do this all the time. Any information you will provide us will be treated with confidentiality. Are you sexually active?
No.
How many partners you had in the past?
More than 2.
Okay, and when you were sexually active, what partner do you prefer, male, female, or both?
Female.
Were you treated or diagnosed for sexually transmitted infections?
No.
What do you use to protect yourself from sexually transmitted infections?
Condom.
Okay, any planned pregnancies in the future?
No.
Okay, now we'll go to your family history. This questions pertains about your parents, your grandparents, on both sides, your siblings and your kids. I'm going to ask about their health status and their age, and if they passed away, the cause of their death.
Okay.
How is your mother?
She's fine.
Any chronic illnesses?
She's diabetic.
And her age?
64.
How about your dad? How is he?
He's fine.
Any chronic illnesses?
He's diabetic as well.
And his age?
66.
How about your grandmother on your mother's side? How is she?
She's deceased. I don't recall the cause of death.
How about your grandfather on your mother's side?
He's deceased, and he had pneumonia.
Okay, and how about your grandmother on your father's side?
Deceased from heart disease.
Okay, and your mother on your grandfather's side, on your father's side?
Deceased. I don't know the cause of death.
Okay. Do you have any siblings?
I have a sister.
How is she doing?
She's doing fine.
What's how old is she?
48 years old.
Any children?
No.
Okay. Um, any family history with blindness or glaucoma or any family history with deafness or ringing in the ears or any family history with mouth cancer, oral cancer, or throat cancer?
No.
Any family with a history of heart diseases, stroke, or hypertension?
No.
Any family history with brain tumor, epilepsy, Alzheimer's diseases, or Parkinson's disease?
No.
Any family history with irritable bowel syndrome, Crohn's disease, or celiac disease?
No.
Any family with a history of kidney stones, kidney cancer, bladder cancer, or BPH?
No.
Any family with a history of thyroid cancer, diabetes, growth disorder, or sexual dysfunction?
No.
Any family with a history of muscular disorder like osteoporosis, osteoarthritis, or gout?
No.
Any family with a history of obesity or cancer?
Obesity?
Any family with a history of bleeding disorder like hemophilia?
No.
Any family with a history of mental disorders like depression, anxiety, or bipolar disorders?
Bipolar disorder?
Any family with a history of genetic disorders like Down syndrome or sickle cell anemia?
No.
Any family with a history of substance abuse?
No.
Any family with a history of allergy to medication, latex allergy, food allergy, or seasonal allergy?
Not that I'm aware of.
Okay. My next set of questions are social history, which pertains about your lifestyle.
Okay.
Where were you born and raised?
I was born in Richmond, Texas, raised in Houston, Texas.
And your nationality?
American.
And your ethnicity?
Caucasian.
And what is your marital status?
Married.
And your occupation?
Stationary engineer.
Did you ever serve in the military?
No, I did not.
What is your living arrangement?
I live with my wife.
And do you have problem paying for your medical bills?
No.
Who is paying for your visit today?
My health insurance company.
Okay, let's talk about your dietary habit.
Okay.
Okay, do you have any food restrictions?
No.
How many glasses of fluid do you drink each day?
6 to 8 glasses.
How is your breakfast like?
I usually don't eat breakfast.
How about your lunch?
I get takeout food or home cooked food.
How about your dinner?
Sometimes I bring food from home or I get takeout food.
Okay. Do you exercise?
Yes.
How often do you?
5 days a week.
Okay. Do you take laxative or stool softener?
No.
Okay. Do you drink caffeinated drink like coffee, soda, or tea?
Soda.
How many glasses a day?
1 to 2.
Okay. Do you smoke?
No, I do not.
Do you drink alcoholic drink?
No.
Do you use drugs?
No.
How is your sleeping habit? Have you been stressed out lately?
No.
How many hours of sleep do you
6
have?
to 8 hours.
And do you feel rested in the morning when you wake up?
Yes.
Okay. And what do you do for fun?
I like social media, news, movies, things
Okay.
like that.
Do you practice alternative healthcare practices like acupuncture, acupressure, yoga, homeopathy, or massage therapy?
No.
Have you been threatened or violated by someone you know?
No.
Okay. My next sets of questions are the review of systems, and these questions pertains about your recent concern.
Okay.
Okay. Any recent fever, chills, night sweats, unusual tiredness, or weight gain, weight loss, unexplained fatigue?
No.
Okay. And how is your eyes? Do you have any blurry vision or double vision or difficulty seeing?
No,
Do you use glasses or contacts?
I do not.
Okay. And do you have difficulty hearing or ringing in your ears?
No,
Okay. Do you have a bleeding from your nose, frequent sneezing, runny or stuffy nose?
no,
Okay. Do you have mouth sores or sore throat? Sore
no,
difficulty eating, difficulty chewing, difficulty swallowing?
no,
Do you have bleeding from your gums?
I do not.
Do you have loose teeth?
No,
Okay. Any chest pain?
no,
Okay. Any fast heartbeat, skip a beat, flutter heartbeat?
no,
Any shortness of breath with or without exertion?
no,
Okay. Any difficulty breathing? Any coughing or coughing anything up?
no.
Have you been tested or treated for a TB?
I tested negative.
Okay. Now we'll go to your muscular system.
Okay.
Do you have any muscular weakness, stiffness, or have there been a change in how much or how far you can move your arms, legs, fingers, or toes?
No,
Has there been a change in your skin, like redness, rashes, or moles, the change in color, shape, or size?
no,
Okay. Has there been a change in your the color or of your breast? Any lumps or nodules? Any discharges from your breast?
no,
Okay. Now we'll go to how is your stomach?
it's fine.
Any nausea, vomiting, constipation, diarrhea, difficulty, or bloody stool?
No,
Okay. Any difficulty or painful urination?
no,
Okay. Any urgency or frequency urination?
no,
Okay. Any unusual memory loss? Any unsteady gait or dizziness?
no,
Any mood swings, mood disorders?
no,
Okay. Any wounds that take time to heal? Any bleeding? Any bruising? Or do you get sick easily?
no,
Okay. Any recent allergies to medication, latex allergy, seasonal allergy, or environmental allergies?
not that I'm aware of.
Okay. Let me put my thing down there. Okay, this is a 43-year-old male, Caucasian, left-handed, obese, well-dressed, sitting upright on the examination table in no apparent distress. He is alert and oriented to time, place, and situation. He is ambulatory and with steady gait and good balance and coordination. He is cooperative and attentive and answer questions accordingly. He maintains eye contact throughout the interview. He has a good hygiene and doesn't have a bad odor, and he is dressed appropriately for the weather. Okay, at this point, I'm going to check for the height and weight and review the vital signs. I'm also going to check the cranial nerve 2, which is the optic, using the Snellen chart, which is also reviewed per instructions. Okay. Throughout the physical exam, I'm going to check for your skin, for motility, appearance, turgor, temperature. I'm going to check for any lesions, edema, inflammations. I'm going to check for rashes, change in color like cyanosis, jaundice, pallor, or erythema. I'm also going to check for any moles, the change in color, size, and shape. And I'm going also to look for some nevi. And if I found one, I'm going to use the ABCDE method of evaluation. For your hair, I'm going to check for the texture, distribution, and if there's some loss of hair. And for your nails, I'm going to look for some cyanosis, pitting, clubbing, and in swelling of your joints.
Okay.
Okay. I'm going to start inspecting your head for any symmetry and any swelling of your face. And I'm going also to check for the shape of your head. The shape of his head is normocephalic, atraumatic, and symmetrical. Next, I'm going to palpate for any abnormalities, masses, nodules, and which I didn't find any. Next, I'm going to check for the temporal artery. Can you open and close your mouth? Okay, no TMJ disorder noted. Next, I'm going to check for the frontal and maxillary sinuses. Do you feel any discomfort
No.
while I'm doing all of that?
No, I don't.
Okay, let me grab my supply here. Okay, I'm going to check the sensory function of your face. This is dull, this is sharp.
Okay.
I want you to tell me what touch you feel on what part of your face. Can
Okay.
you close your eyes
Sure.
for me?
Dull on my forehead,
Okay.
sharp on my right cheek, dull on my left cheek, dull on my chin.
Okay, thank you. Okay, can you close your, can you open and close your mouth? Can you look up? Wrinkle your forehead? Frown? Close your eyes? Puff out your face? Okay, cranial nerve 5, trigeminal and cranial nerve 7, facial are all intact. Now we'll go to examination of your eyes. So I'm going to first I'm going to check your eyes, visually inspect your eyes for some drooping, for any abnormalities. Then I'm going to check the sclera. Sclera are white. I'm going to check for the conjunctiva pink, no redness or inflammation. I also noted the cornea, lens, iris, and pupil. Next, I'm going to check the 6 cardinal gaze. Can you follow my finger with
Okay.
just your eyes?
Sure.
Going in. Okay, and take care of the cranial nerve 3, which is oculomotor, 4 trochlear, and 6 abducens. Now I'm going to grab my ophthalmoscope and check for the perla. Okay, pupils equal, round and reactive to light and accommodation. Now what I'm going to do is I'm going to get very close to your face
Okay.
and I shine a bright light in your eye, and don't look at the light until I tell you to do so.
Sure.
Okay, can you look at the light? Okay, so what I see is the red reflex. I also noted the retina, optic disc to cup ratio, which is 3:1. I also noted the macula, fovea, arteries, veins, and vessels. Now I'm going to repeat the same process on the other eye. Okay, I noted the red reflex and retina, optic disc to cup ratio, macula, fovea, arteries, veins, and vessels. Now we'll go to your ears. I'm going to check the ears for any abnormalities, any skin discoloration. I'm going to check the ear canal for any discharges, which I didn't find any. Now I'm going to check the hearing loss. Can you cover your left ear and repeat what I said?
5. Apple. Dog.
Can you do the same in your other ear?
Okay. Mother. Paris. 11.
Okay, and that's a pass. Now what I'm going to do is I'm going to grab my tuning fork and I'm going to put this on your forehead. And you tell me if you hear the vibration equally on both ears, or otherwise if which ear is louder and which ear is softer.
Okay. I hear it in both ears.
Okay, so no conductive hearing loss. Next, I'm going to do the Renate test, which I'm going to do is put the tuning fork behind your ear, and then you tell me if you don't hear the vibration anymore. I'm going to switch it in front of your ear.
Okay. Okay.
Okay, and I'll do the same process on the other ear.
Okay. Okay.
Okay, cranial nerve 8, which is auditory, is intact. Now I'm going to grab my otoscope and look inside your ear. Okay, what I'm seeing is a pearly gray tympanic membrane, cone of light, malleus, no injection, no irritation or inflammation noted. Going to the other ear. Okay, what I'm seeing pearly gray tympanic membrane, cone of light, malleus, no irritation or abnormalities noted. Now we'll go to your nose. So what I'm going to do is check the nose for deviated septum, which I didn't find any. And can you cover your nostril and breathe in and out, and do the same on the other nostril. Breathe in and out. Okay, nostrils patent. Now I want you to close your eyes and tell me what is now.
Alcohol.
Okay, cranial nerve 1 olfactory is intact. Now I'm going to look inside your nose. Okay, nasal mucosa and turbinates are moist, pink, intact. No inflammation, no discharges, and so is on the other ear. Nasal mucosa and turbinates are all intact. Okay. Now we'll go to the mouth. I'm going to inspect the mouth for any ulcers or mouth sores. I'm going to inspect the lips for any cracking or scaliness. Next, can you open your mouth for me? I'm going to inspect the gums for any bleeding and for any loose teeth. Next, I'm going to grab my otoscope here. Can you open your mouth for me? Okay, stick out your tongue. Say Okay. Okay, what I see is soft and hard palate, moist, pink in top, anterior and posterior pillars noted. Tonsils grade 1 plus. Can you stick out your tongue? Bring them side to side. Okay, bring them up. Okay, and cranial nerve 9, glossopharyngeal 10, vagus, and 12 hypoglossal are all intact. Next, we'll go to the neck. I'm going to visually inspect the neck for any enlargement, for any skin discoloration. I'm going to palpate for the lymph nodes, starting with the preauricular, parotid, postauricular, occipital, tonsillar, submandibular, submental, going down to the cervical chain, superficial cervical chain, deep cervical chain, anterior cervical chain, and posterior cervical chains, and none of these lymph nodes are swollen or inflamed. Next, I'm going to check for the trachea. Trachea is midline. I'm going to check for the thyroid. Okay, can you swallow for me? Okay, thyroid drop, no goiter or nodules noted. Next, I'm going to, can you raise your shoulder? Okay, cranial nerve 11, spinal accessories intact. I'm going to check for the jugular vein distension, which is non-noted. Okay, that's our head and neck, and then I'll go to the thoracic, cardiovascular, and abdominal inspection next. Can I ask you to take off your shirt for me?
Okay.
Are you okay? You're not cold or anything like that?
No.
Okay. For the thorax, I'm going to inspect the skin for any discoloration, for any cyanosis, pallor, jaundice, or erythema. I'm going to check the thorax for symmetry. I'm going to check the respiratory for rate, rhythm, and effort. Next, I'm going to check for tenderness. You feel any tenderness?
No.
And then for skin turgor, skin is well hydrated and tight. Then I'm going to check for the AP diameter, which is 2:1, which is a normal finding. Next, I'm going to auscultate for the lung sound. Take a deep breath from me. Okay. Lung sounds clear throughout. Next, at this point, I'm going to teach and educate the patient about a breast self-exam. As we know, breast cancer doesn't only happen on females. So if you notice any abnormalities, any nodules, any discharges from your nipple, have call your doctors and have an appointment, so you'll get a diagnosis and proper treatment.
Okay.
Okay. That's our thorax. Next, I'm going to examine the back. Can you turn for me, please? Okay. I'm going to inspect the back for any abnormalities, for any skin discoloration, for any rashes or inflammation and lesions. Next, I'm going to check for the thoracic expansion. Can you take a deep breath? Okay, one more. Okay, lung expansion equal and symmetrical. Next, I'm going to check for the tactile parameters. Can you say 99?
99, 99, 99, 99, 99.
Okay, and that's tactile parameters. Next, I'm going to palpate the lungs. And what I'm hearing is resonant, which is a normal finding. Next, I'm going to percuss for the thoracic excursion. What I want you to do is I want you to take deep breath in and out, and then hold your exhale. Okay, now what I want you to do is the breath in and out and hold your exhale and your inhale. Okay, about 2 to 3 centimeters here. Now we'll do the same on the other side. Okay, can you breathe in and out for me and hold your exhale? Okay, and can you breathe in and out for me and hold your inhale this time? Okay, about 2 to 3 centimeters on this side, which is normal. Next, I'm going to listen to your lung sounds. You take a deep breath from me. Okay. Lung sounds clear throughout the lung fields. Now, we're done with the back. Now, we're going to examine the front. Okay. So, I'm going to inspect the anterior chest for any abnormalities, for any discoloration of the skin, for any cyanosis, jaundice, pallor, or erythema. I'm going to check for the thoracic expansion. Can you take a deep breath for me, in and out? Okay, thoracic expansion is equal and symmetrical. Next, I'm going to check for the tactile parameters. Can you see 99?
99, 99, 99, 99.
Okay, thank you. Next, I'm going to percuss your lungs. What I'm hearing is resonant, which is a normal finding. And then I'm going to listen to your lung sounds. Take a deep breath. Okay, lung feels clear throughout. Okay, we're done with thorax. Now we'll go to your heart, or the cardiovascular system. I'm going to inspect the heart for some heaves or lifts. And I'm going to palpate for any heels or thrills. I'm going to palpate for the apical impulse, which is felt. Next, I'm going to feel for the carotid artery, and I'm going to listen for some bruits using the diaphragm of my stethoscope. Okay, I'm going to do the same process using the bell of my stethoscope. Okay, and no bruits noted. Next, I'm going to listen to your heart sounds using the 8-2 mnemonics. Aortic, pulmonic, Earth's point, tricuspid, mitral. Then I'll do the same process using the bell, looking for some low pitch sounds like murmur. And what I'm hearing is S1 and S2. Okay. Now, can I ask you to lay down for me?
Okay.
Okay. So I'm going to check for the jugular vein pulsation, and I'm going to look for the jugular vein pressure. I'm going to look for the highest oscillation and grab here in my tape. Okay, and it's 3 inches, and that's a normal finding. Now I'm going to check for your heart sound lying down. Aortic, pulmonic, Earth's point, tricuspid, mitral. I'm going to do the same process using the bell. And no murmurs noted. What I'm hearing is S1 and S2. And that's our cardiovascular examination. Can I ask you to sit down for me, please, so I can check more lymph nodes? Okay, I'm going to check for the pectoral nodes, lateral, and subscapular, supraclavicular, and infraclavicular. And none of these nodes are swollen or inflamed. And can I ask you to lay down?
Okay.
Thank you. Next, we'll go to the examination of the abdomen. I'm going to check for any heaves, pulsation, hernias, or scars. Can you bend your knees for me to relax your stomach? Next, I'm going to listen to your abdominal sound. I can't put this down. Let's see you more. How's that?
That's better.
Okay. Going to listen to your bowel sounds. Two places on each quadrant. Okay. Vowel sounds normal and active on all quadrants. Next, I'm going to listen for some bruits, starting on your abdominal aorta, renal artery, iliac arteries, and then femoral artery. Okay, and I'll do the same process using the bell. Renal artery, iliac arteries, and femoral arteries. Okay. Now I'm going to percuss the abdomen. And what I'm hearing is tympani, which is a normal finding. Next, I'm going to palpate using a light palpation to feel for any pain or tenderness. Do you feel any pain or tenderness
I do not.
all of that? Next, I'm going to do the deeper palpation for tumors, to feel for tumors or masses, which I did not feel any. While lying down, I'm going to percuss for the liver span. Okay. About 7 to 8 centimeters, which is normal. Next, I'm going to palpate the liver. Okay, can you take a deep breath for me? And out. Okay. Next, I'm going to percuss the spleen. And feel the spleen. A normal and healthy spleen is non-palpable. Next, I'm going to palpate the kidney. Okay, can you take a deep breath for me? And out. And out. Okay. And the other side. Okay. Kidney is non-palpable, which is normal. Next, I'm going to check for aortic pulsation or pulsatile masses. And none of this is felt. Next, I'm going to check for the femoral arteries and inguinal lymph nodes. Okay. And can I ask you to sit up for me, please?
Yes.
And can you turn the axis to your back? Turn some more. Thank you. Next, I'm going to do the CVA. Tell me if you feel some tenderness. You feel any tenderness while you did all of that?
No.
Okay, thank you. Now can you lay back down for me?
Yes.
Or I mean just stay seated. Okay. Now I'm going to teach Greg and educate Greg about the testicular self-examination. Have you been doing your monthly testicular self-examination?
Yes.
Okay, so if you feel any nodules or any abnormalities, don't hesitate to call your doctor and make an early appointment.
Okay.
Okay, thank you. Next, after that, I'm going to check the spinal, the back and the spine. For any abnormalities, I'm going to visually inspect the spine for any skin discoloration. I'm going to inspect or feel for any tenderness or discomfort. Next, I'm going to check for the skin turgor. Skin is well hydrated. Can you lean forward, backward? No scoliosis and kyphosis noted. Next, we're going to check how much motion you have on your spine. You can turn towards me. What I want you to do is bring your chin down to your neck. Look up to the ceiling, and down, and then can you turn to your side, left side, all the way, and to your right side, all the way, and bring your ear to your shoulder, and your other ear to your shoulder. Do you feel any discomfort doing all of those motions?
No.
Okay. Now we'll go to the examination of your upper extremities, which include your shoulder, your elbow, your wrist, and your hands. I'm going to inspect the upper extremities for any abnormalities, for any skin discoloration, for any ulcers. I'm going to palpate for any pain or discomfort or any tenderness. Then I'm going to assess and check for your motion and strength of your arm.
Okay.
So we'll check the motion first. I want you to follow what I'm doing.
Okay.
Can you raise your arm upward from your side, down? Raise your arm from your side, up, down. Arms across your chest, on each shoulder, down. Bring your hands on your back, down, forward, down, palms down, palms up, wrist down, wrist up. Spread your fingers, bring them together, make a fist. Do you feel any tenderness doing all of those motions?
No.
Okay, now we're test the strength of your upper extremities. Can you give me resistance? Okay. Can you push out? Push in? Push up? Push down? Can you spread your fingers? Bring them together. Okay. Can you push out? Push in? Push up? Push down? Okay. And spread your fingers. Bring them together. Okay. Do you feel any tenderness doing all of those exercises?
No.
Okay. And at this time, I'm going to check the fingers for cut refill. It's below 3 seconds, which is normal finding. Next, I'm going to check for a couple more of lymph nodes, starting with the epitrochlear and axillary. Okay, and none of these lymph nodes are inflamed or edematous. Next, I'm going to check for the deep tendon reflex, starting with the tricep, bicep, and brachioradialis. Okay. Need to do the same on the other side. Tricep, bicep, and brachioradialis. Okay. Now I'm going to feel for your pulses, starting with the brachial, radial, and ulnar. Brachial, radial, and ulnar. What I'm going to do next is to check the sensory function of your upper extremities. So what I want you to do is you close your eyes and tell me what touch you feel. If it's dull or sharp, on what side, on what part of your arm, and what side of your body.
Dull right bicep, Sharp, left bicep. Dull, right wrist, forearm. Dull, left forearm.
Okay, very good. Okay, now we'll go to the examination of your lower extremities. Okay, what I want you to do is raise your left leg, right leg. Okay, bring them together. Okay, can you raise your left leg, pop your balls side to side, spread your toes, make, okay, and then curl them, and then do the same on the other leg. Okay, and pop your toe, okay, side to side, spread your toes and curl them. Any tenderness doing all of those motions?
No.
Okay, now we'll check the strength of your lower extremity. Push up, push up. Can you push out, push in, push out, push in? Okay, can you push up, push down, push up, push down? Okay, good strength. And now I'm going to check the tendon reflex, starting with the patellar. And then can you flex your foot? And the Achilles tendon. Then do the same on the other leg, patellar. And then flex the Achilles tendon. Okay. Now I'm going to check for the pulses, starting with the popliteal, dorsalis pedis, and the posterior tibialis. We'll do the same on the other leg, popliteal, dorsalis pedis, and posterior tibialis. Now I'm going to check for the sensory function of your lower extremities,
Okay.
Using the dull versus sharp method. So I want you, what I want you to do is I want you to close your eyes and tell me what touch you feel on what part of your leg and what part of your body.
Okay. Sharp, right thigh. Dull, left knee and thigh. Dull, right calf.
Again.
Sharp, right calf. Dull, left calf.
Okay, very good. Next, we'll check your gait, to examine your gait. I want you to stand up for me. And then, can you raise your leg? One at a time. The other one. Okay, bring them out in front. Pop your balls up and down, side to side. And spread your toes and curl them. And then do the same on the other leg. Bring them up forward. Pop your balls up and down, side to side. Spread your toes and curl your toes. Okay. And now what I want you to do is bring your feet together and bring your raise your arms sideways and close your eyes. Okay. Now you can bring them down and open your eyes. Now I want you to bend down and touch your toes to check for scoliosis and kyphosis standing up. Thank you. Now can you walk towards the wall? Okay, and then back towards me. Okay, and that concludes our history and head to toe physical exams. Thank you, Greg.
Thank you.